Thumb injury. Patient profile: 22 years old male, orchard laborer and fruit picker, hand dominance right-handed, presenting complaint: a cut to the left thumb from a pruning knife sustained 1 hour ago at work. Initial observation: minor bleeding controlled by a pressure dressing. Linear knife cut through cotton gloves. Edges of the wound have sealed and bleeding has stopped. Approach the patient and initial interaction. Greet the patient and introduce yourself. Confirm identity and explain the assessment process. Provide reassurance and gather additional details about the injury. History taking. Mechanism of injury. Confirm how the injury occurred and the tools used. Occupation specific questions. Assess risk factors related to work. Hand dominance. Confirm which hand is dominant for functional assessment. Tetanus immunization status. Medical history. Ask about diabetes, bleeding disorders, allergies, or medications. Physical examination. Inspect the wound. Size, depth, contamination, and signs of infection. Assess for tendon, nerve, or vascular injury. Sensory check. Test sensation in the thumb, median, ulnar, and radial nerve distributions. Motor function. Assess the patient to move the thumb, checking flexion and extension. Vascular supply. Check capillary refill and pulses. Examine surrounding tissue for swelling, redness, or foreign bodies. Explanation and recommended management. Explain findings. You have a superficial linear cut with no major damage to tendons, nerves, or blood vessels. Wound care. Clean the wound with saline or antiseptic solution. Closure options. Steri-strips or adhesive glue for minor cuts. Sutures if the wound is deeper or wider. Tetanus prophylaxis. Update if not current. Antibiotics if contamination or infection risk is high. Dressing. Apply sterile dressing and provide instruction for care. Pain relief. Prescribe analgesics as needed. Work advice. Restrict heavy use of the thumb temporarily. Commentary to examiner. Highlight examination findings and justification for the management plan. Explain the reasoning for tetanus prophylaxis and antibiotic use. Discuss functional consideration for occupational impact. Answers to examiner's questions. The possible questions. What signs would suggest nerve or tendon injury? Answer: loss of sensation, weakness in flexion or extension, or inability to oppose the thumb. When would you refer for specialist review? Answer: deep wound involving tendons, nerves, or joints, or infection is suspected. Key focus areas for assessment. Effective history taking and examination technique, clear communication and patient education, appropriate initial management and follow-up recommendations, confident responses to examiner's queries. Follow-up advice for patient. Keep the dressing dry and clean. Return for a wound check or if signs of infection, redness, swelling, or pus develop. Remove stitches in 7 to 10 days if used. Gradual return to full activities as healing progresses.